This is where COVID-19 meets the world's worst man-made humanitarian disaster. 5 years of conflict, disease, poverty and corruption have already killed at least 100,000 people. Now those left must survive a pandemic as well. Ammar Derwish has been a volunteer doctor in Aden since the war.
There was no option for me as a general practitioner other than to stay at home or to go to try to help people.
Aden officially recorded its first 5 cases of coronavirus at the end of April. Most medical facilities are either unable or unwilling to help. Ammar is visiting Al Wali Hospital, one of the few to take in COVID patients. He meets Dr. Al-Turki, who was running the emergency room when there was an explosion of cases.
تاريخ 27/4 هذيك اليوم كانت العشرات الحالات، اعتقد 12 حالة جاءت بنفس اليوم من الصباح. تمام، في حالتين او 3 حالات وفيات هنا في الطوارئ، توفت من الطوارئ. مع بعضهم كان يعني نتريد بصراحة بذاك الشكل لأنه فير، يعني خايفين من العدوى، خايفين من انتقال العدوى لأهاليهم لعوائلهم. ذاك الوقت ما كانش متوفرة معانا الPPEs.
He was right to be frightened. The next day, Dr. Al-Turki is diagnosed with COVID-19. Due to a lack of testing, this CT scanner is the next best way to identify new patients, which, according to Ammar, is how the head of ICU found out he is also positive.
So he thought, okay, I have to go to do CT scan to check. He didn't expect it to be COVID-19. But Dr. Ammar said he was in contact with a lot of COVID-19 positive patients.
He now occupies one of 4 isolation rooms, and his ICU is closed. Around 80% of the hospital's staff are either sick or at home showing symptoms. Dr. Nasser has managed to get his mother admitted, but there's no room left for his cousin.
They are complaining he has fever more than 3 days, but they searched for hospital. They couldn't find any hospital accepted him, no beds. And yesterday, unfortunately, he died. Most of the government hospitals closed. Most of the people will die in the home. Most of the people will die in the home.
Officially, there have been 5 coronavirus deaths in Aden, but with hospitals closed, the authorities can't keep tabs on new cases. Many fear a much larger catastrophe is quietly unfolding in the community.
عندنا كورونا او ما فيش عندنا، ناس يقولوا عندنا ناس يقولوا مش عندنا، بس نسبة الموتى عندنا كثير والسبب ما نعرفش، ناس يقولوا حمى، ناس يقولوا مكرفس، ناس يقولوا حمى الضلع، ناس يقولوا ما عندنا مساجين، مش عارفين أي حاجة.
As the authorities in Aden falter, doctors like Ammar try to treat people at home who can't access hospitals.
If there is anyone having any problem and I can help, I will help. I have to share my knowledge.
Ammar is making house calls. On his street alone, 5 families are showing symptoms. He's revisiting a patient who fell ill 2 days before the first official cases. Wagdi al-Iraqi is diabetic and 2 weeks earlier could barely breathe. He's now in recovery, but his neighbour had the same symptoms and died last week. But laying up at home isn't an option for those who don't have one. 25 families displaced by the war live in this makeshift camp. Over 2 million people in Yemen have suffered from cholera. Now flooding has brought malaria and dengue fever to the shack Musad calls home. He lives here with his wife and 19 other family members amidst the sewage.
Where we can go.
For these people, COVID-19 is just one more disease on a long list of evils that can kill them. The World Health Organization predicts at least 65,000 COVID-19 deaths in Yemen. Across all its fractured territories, including Aden, just 88 coronavirus-related deaths have been officially registered. But Aden's graveyards tell a very different story. There are around 7 times more burials than a few months ago. 950 in the first half of May alone. Leading experts here predict around 85% of deaths are happening outside of hospitals. But this is just a couple of weeks in one enclave of Yemen, in a divided country where so many people are already struggling with 5 years of war. The true scale of COVID-19's silent reach may never be truly known.